All right, so I'm gonna go over sinuses. Again, sinuses are gonna be at 40 inches. You can ask the exact same history as you would use for facial bones, with the only difference asking if they have any sinus pain or pressure and which side that would be on and if it's causing headaches. A lot of times the most common reason for sinus x-rays is sinusitis, which is chronic sinusitis. So I usually start with the PA, and the PA Caldwell, I'm gonna angle my tube down 15 degrees caudal. Again, we're gonna stay at that 8x10 collimation size. I'm gonna put my marker on the correct side. I'm gonna make sure that my OML is perpendicular to the IR, which that looks good right there. And I'm going to exit at the nasion. If you can't see, just open up the light so you can use that line again. And then make sure to close it back down for collimation. And that's all lined up there. So again, I'm gonna come behind her, make sure that that mid-sagittal plane is centered, and then that there's no rotation. And I would have her hold her breath, don't breathe, don't move. After that, I'm just gonna go right into the waters again. I'm gonna take my angle off. I'm gonna have my patient bring their chin up so their mental meatal line is perpendicular. Lean back just a little. Okay, go ahead. So I'm gonna check from the mandibular symphysis to the EAM, make sure that MML is perpendicular. Then I'm gonna come up, make sure that I'm centered exiting at the acanthion. This board's gonna raise up in front of you. I'm gonna move that board there. And then again, I'm gonna just check to make sure that there's no rotation and that her mid-sagittal line is centered. And I would have her hold her breath, don't breathe, don't move. If we were gonna do the open mouth waters, we would stay in that same position, have the patient hold nice and still, and then just have them open their mouth as wide as they can. After that, we're gonna do the lateral. So we're gonna pretend it's her right side that's affected. I'm gonna have you turn towards me, put your right side up against that board, the right side of your cheek, good. We're centering in the same spot as the facial bones, right on the zygoma, or midway between the outer canthus and the EAM. This board's gonna lower down, don't let me hit your shoulder. I'm gonna put my right marker on the anterior side, and then I'm gonna get right down again. I wanna make sure that those interpupillary lines are perpendicular. So I'm gonna have my patient kind of tilt your head out just a little and then look that way just a little. Good. So mid-sagittal plane is now parallel. Interpupillary line is perpendicular. It changed my centering a little bit, so I'm gonna move her just slightly back. Sorry, I'm trying to push on you. And this is gonna lower down just a little bit. Once I move her, it's really important to come back and check. Okay, go ahead and look at me again. Turn this way just a little. And then tilt the top of your head out just a little bit. Because that can change everything when you move them. So I'd have her hold her breath again, and then she can breathe and relax. The last view I do, I'm gonna take this, is the SMV, and I do this last because it's the most uncomfortable for the patient. So go ahead and turn and face out into the room. You wanna bring your patient about 12 inches away from the IR so that they have space to tilt back. And what you wanna do is tell your patient, I want you to lean back till the top of your head is touching this board.
Oh no.
Yeah, I'm gonna push it back a little bit more. Okay, go ahead. So for this one, we're wanting the IOML, the infraorbital meatal line, parallel to the IR. And then what we want to do is center midway between the gonions. This board's going to move just a little bit. We want to be still kind of at that mid-sagittal plane, and then we need to double check that there's no rotation. I'm going to twist you just a little, sorry. All right, so that there's absolutely no rotation on this one. And again, that IOML is parallel to the IR. So then take your patient's picture, hold your breath, don't move, and then when you're done, help them get up because it's very uncomfortable for your patient. Make sure you're as set up as you can possibly be before you bend them up because it's not very comfortable.